we are covering common exclusions and limitations for the health insurance licensing exam. The exam expects you to know not just what is excluded, but why. Exclusions exist to manage risk, keep premiums affordable for the majority, and prevent adverse selection, which is the tendency for high-risk individuals to seek more insurance. A core principle tested is that insurance is for unforeseen events, not for certainties or elective procedures. One of the most tested and commonly misunderstood exclusions involves pre-existing conditions. Because of the Affordable Care Act, or ACA, health insurers can no longer deny coverage or charge more for pre-existing conditions like diabetes or cancer in any ACA-compliant plan. An exam trap question might present a scenario with an applicant who has a chronic illness applying for a major medical plan and ask if the insurer can attach an exclusion rider. For an ACA-compliant plan, the answer is no. However, be aware that non-compliant plans, like short-term health insurance, may still have exclusions for pre-existing conditions. Another key area is the waiting period, which is often confused with a probationary period. A waiting period is the maximum amount of time, by law, that an eligible employee must wait before enrolling in a company-sponsored health plan, which cannot exceed 90 days. A probationary period is a separate employment-related timeframe that still counts toward the 90-day waiting period. The exam will test this with a scenario such as an employee starts a job with a 30-day probationary period. Their health insurance coverage can begin on day 1 or any day up to the 90-day maximum, but not after. Cosmetic surgery is another frequent topic. The exam will focus on the distinction between cosmetic procedures, which are elective and not covered, and reconstructive surgery, which is medically necessary and is covered. For example, a rhinoplasty to change the shape of a nose for appearance is excluded, but a septoplasty to correct a deviated septum that impairs breathing would be covered as it is medically necessary. You must be able to identify the primary reason for the procedure to answer correctly. Injuries covered by workers' compensation are always excluded from health insurance policies. Health insurance is designed for non-occupational injuries and illnesses. The exam question will be direct. If an individual is injured at their place of employment, which plan pays? The answer is always workers' compensation. The health insurer would deny the claim as it's a work-related injury. Other standard exclusions you'll be tested on include acts of war, intentionally self-inflicted injuries, and experimental or investigational treatments. These are all situations that represent uninsurable, catastrophic, or morally hazardous risks that health insurance is not designed to cover. A simple way to remember the logic behind these is a mental shortcut. Health insurance covers the unforeseen and medically necessary, not the elective, experimental, or employment-related. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.